Picture courtesy, Ian's. The COVID-19 had a severe impact on our mental health. Now, a new study says that during months of isolation due to COVID-19, women suffered more than men did. Women had disturbed sleeping patterns, anxiety, depression, and was under trauma. Also read, Rajnikant tests negative for COVID-19 after 7 crew members test positive, and Nathe shoot halted the findings, published in Frontiers in Global Women's Health, suggests sex and gender differences may play a role in psychological and behavioral reactions to the pandemic. Also read, Karnataka imposes night curfew from 10 p.m. to 6 a.m. until January 2 amid concerns of COVID-19 new strain. These differences need to be considered in planning targeted psychological interventions, the researchers said. Also read, mucormycosis, fatal infection found in COVID-19 recovered patients. Know all about the condition for the study. The researchers examined data from 573 participants, 112 men and 459 women with a mean age of 25.9 years, in Canada. At the time of the online survey, schools and many businesses were closed, and people stayed home as much as possible as part of a general lockdown to prevent transmission of the virus. More than 66% of the volunteer participants reported poor quality of sleep. More than 39% reported increased symptoms of insomnia, and anxiety and distress were increased in the whole sample. Sleep, depression, and anxiety symptoms were more prevalent in women, said the study. Generally, the study found women reporting more anxiety and depression, said lead researcher Veronica Guadagni from Cumming School of Medicine, CSM, University of Calgary, Canada. Their symptoms worsened over time and with greater length of the isolation period. There was a progressive increase in anxiety, depression, poor sleep quality, and trauma for males and females. But it was greater for females over time. The study also found that women reported higher scores on a scale measuring empathy, the ability to understand the emotions of others, and to care for others. The greater empathy was, however, associated with greater anxiety, depression, and trauma. The authors speculate women's greater concern and anxiety in relation to being caregivers reflects differences in gender roles and norms. With inputs from Ian's, for breaking news and live news updates, like us on Facebook or follow us on Twitter and Instagram. Read more on latest lifestyle news on India.com. Topics: Anxiety, COVID-19, depression. Published date: December 23, 2026, 03 p.m. IST. Please support us to grow my channel by subscribing and pressing the bell icon for future interesting lifestyle videos.